Then I started out with the terrible joint pain and aches.
I'm having some muscle and joint, I might call it stiffness.
My white count did go through the roof.
There were several times to the point that I could not even walk. And it was constant.
The fatigue was already there as I began, and on ibrutinib, but then I had the joint. That was the most prominent thing that first week or two was the joint and muscle pain that was there, and muscle cramps. Those things were just a little bit overwhelming, but they diminished with time. And then following that, I had the brittle nails that came along and frizzy hair.
The other trick that I've used sometimes, especially if it's happening early on, is to actually add a low dose of prednisone, which is an anti-inflammatory drug. And that can sometimes take those aches away. And then as your body adapts to the BTK inhibitor, sometimes you can stop the prednisone and not have the pains as much. But I've had patients where the aches and pains are so difficult to deal with on one BTK inhibitor that we actually just try switching to a different BTK inhibitor. And sometimes that's been successful as well.
Neuropathy came along at about a year and a half. And I continue to have, it's not a pain, but it's a kind of a numbness in the feet and a tingling in the hand sort of thing.
I've tried things like reducing the dose of ibrutinib, for example, to see if that helps, maybe with some success. And then if it's a painful neuropathy, there are drugs you can take to help manage the pain, like gabapentin, for example, can be very helpful for that type of pain.
Headaches, I had it for maybe the first 5 weeks, and it improved. And the first month I started I don't know if I had neuropathy to begin with, but if I didn't, neuropathy worsened, whether as I said, I think I had it in a minor part to begin with, and it worsened. And sometimes fatigued, but certainly not as fatigued as I had been in the past on other treatments.
I started experiencing GI issues to the extreme that were difficult to control, and maybe part of that was my fault for not taking enough Pepto, or then switching to Imodium and really stepping up how much I would take of that. So I have been taking 2 Imodium a day to control the GI issues, and I'm still in the early stages of trying to get that under control, but I think I'm doing a lot better so far.
So I went for a routine physical, and my doctor called me that night. He said, "Jane, you're an AFib, and you need to call your doctor immediately." And I did, and I started on something called Eliquis that probably everybody has seen for blood clots. And then I began what feels like, even though it hasn't been, an endless few months of trying to get this thing under control. It is unclear to both my electrophysiologist, who is a cardiologist who deals with heart rhythms, if I had AFib prior or not. I don't know, but I was never very aware of it.
I think that's to some degree kind of side effect specific, but I think Jane's example is a great one where getting a cardiologist involved early, I think, is very helpful. Some of the larger centers like here, and I'm sure at Cornell as well, there's particular cardiologists who have certain expertise in some of the complications from cancer therapies, so-called cardio-oncologists. And I think we're starting to see that more and more at bigger centers for other diseases as well, like kidney disease. We have some onconephrologists, and we have gastroenterologists now who are interested in oncology. So if you're at a big center, I think it's great to have that, but I don't think that's completely necessary either. If you're in a smaller practice, it's helpful if your oncologist has a relationship, even if it's with sort of a general cardiologist or a general dermatologist, to be able to get access to them fairly quickly and have that dialogue and communication, because sometimes these subspecialists, especially if they're not oncocardiologists, they may not know a lot about BTK inhibitors. because that's not part of their practice. But if you have good communication between the oncologist and the cardiologist, I think that's really key to optimize the management of the side effects.
In this program here with the patient story, we have Dr. David so that we can find out the ways to go about it. It is great to have the support from other patients, but to know who the patients out there, I guess, also who are credible and base things on medical advice, or those who perhaps are finding it in other ways. So so in thinking of ourselves as dealing with doctors and helping patients become better at self-advocating.
We're again sort of in a very exciting time right now for patients with CLL. We've had so much progress in the last decade, but there's so many other exciting things going on right now.
I try to keep a good open line of communication. I have a local oncologist, and then I also travel out 3 states away to see a specialist. And they work very well together. They keep communication.
I think some of us are just very stoic, and it's okay to get some help sometimes.